Yes, perfect.
Hello, everyone. My name is Shane Thilman. I'm the Chief Information and Digital Officer at Scripps Health in San Diego. Pleased to join you, I guess it's this evening, there in Germany. I will just walk through kind of a composition of a variety of different initiatives that are in various phases of deployment at Scripps that really touch on our journey around digital transformation. And I'll move through them quickly and happy to take any questions along the way as well. So just very briefly, a little bit about Scripps Health. We're a not-for-profit integrated healthcare delivery system here in San Diego. And you can see some of the other vital metrics here. I'd say that probably one of the key distinguishing characteristics of our organization is really the focus that we have on our culture, including employee engagement, as well as development of physician leaders, which it really is essential to digital transformation and really helps define how we're evolving as a care delivery system and the care models that are continuing to evolve as well as it relates to identifying new opportunities for producing value. So that's really the backdrop for my comments today. So one of the ways in which we're approaching digital transformation in our organization has really been focused around centralization and opportunities to really drive standardization, effectiveness, and efficiency. We have launched what we call our SHOC, or our Scripps Health Operations and Command Center. It's really a system-wide hub that's intended to help us reimagine health system performance, again, by focusing on where we can get economies of scale through centralization, but also really enhanced coordination. And so I would say that this is very similar to what NASA did probably 65 years ago. They really pioneered the concept of a centralized command center to help improve the speed and accuracy of decision making. And that was really centered around space missions. And so it involved placing key decision makers in one location and arming them with access to all of the relevant information that was necessary for them to make decisions in real time. And this sort of trend has spread across a variety of different industries over time. And I think we're seeing more of this in healthcare today as well. We launched our work about 3 years ago. We identified 5 programs for prioritization. I'm going to talk about 2 today that are really about affecting patient flow and throughput in our hospitals, and then some novel work that we've been doing to really centralize telemetry. And this is actually the physical location of our command center. It's an administrative space, so it's not on our hospital campuses. And we're quite excited about the progress that we're making. And so I'll share a little bit more about that. So first, when we talk about flow and throughput, one of probably the greatest areas to affect cost, but also to drive improvement in clinical performance is really around looking at length of stay. And there's a variety of different mechanisms that can be employed in order to affect length of stay. We've chosen to focus on sort of the gray space. So all of the logistics that support patient movement and throughput through their episode of care. And what we've been able to demonstrate really importantly is that we've been able to really address avoidable days. We've been able to help tie back some of the work that we've been doing in this area to reduce length of stay. And we've been able to drive really demonstrable improvement in cost structure, but also access because we have limited capacity and staffing. And so anything that we can do to free up bed capacity is really important, particularly as we see increased volumes in our emergency departments. And so one of the steps that we took last year was to really centralize our bed placement process. And it's been remarkable in terms of some of the results that you can see here. We've seen reduction in variation in communication and patient placement by developing system-wide bed placement guidelines that have really been developed from the bedside across our 5 hospital campuses, but are executed and implemented centrally. We've seen really a pretty significant increase in the improvement of accuracy in bed assignments. We've seen reduced time from bed request to bed placement. which means really less time in the ED for patients, and improved access and timely transitions of care. And we've seen greater consistency and effectiveness in patient transport, as well as our environmental services team and their ability to turn rooms over. So take a dirty room after a patient is discharged, have that room cleaned and ready for the next patient placement. And you can see our median discharge time is 250, and that's actually continuing to improve. And so we have a program or an initiative that really focuses around discharge order written by 10 a.m., patient discharged by 12, and bed ready for next patient by 2 p.m. And so we are making great progress towards that target state. Another program in shock that just launched actually back in May has really focused around what we're calling our Central Patient Monitoring Center. And so we've been doing virtual patient observation in our organization for many years. So that's our virtual telesitter program. So patients that are at risk for falls are monitored centrally. And that allows us to free up capacity for nurses and our patient care assistants. And that's been invaluable to us throughout the COVID pandemic and now beyond. But one of the opportunities that we also identified was really around telemetry in our organization. And so we have an average daily census in our hospitals of about 1,000 patients, and a little over half of those patients are on cardiac monitoring. And so we were able to consolidate our technology footprint. We were able to take our telemetry technicians out of the individual hospital campuses, really codify a standard for tech to patient ratio. We saw a lot of differentiation at each of our hospital campuses in terms of how the service was managed. We were able to really codify standards for telemetry admission, transfer, and discharge, standards for hiring and training our telemetry technicians, and then we were able to deploy a quality improvement program and really drive access to waveforms to the point of care for our physicians, for our nurses. And so we've really cleaned up how we communicate between those that are at the point of care and those that are in our central telemetry monitoring unit. So these are just some pictures of the group, and we are wrapping up our transition in August with our remaining 2 hospital campuses. But this has been a great success for our organization. And again, it really amplifies how we're using this sort of centralized coordination and capability to drive improvements in our care delivery processes, but also in our cost structure. So I'll pivot. I'll talk a little bit about digital health. This is another area that we spend a lot of time and focus on, and it certainly is not just an IT activity. It's really an enterprise-wide engagement and activation of our physicians, of our administrators, and those that are delivering care at the front lines. And so we really see digital and virtual as an opportunity to distinguish ourselves in our community. We see them as differentiators in terms of driving patient satisfaction, but also loyalty. And so one of the things that we've done is really tried to profile where we are in our digital and virtual health journey with our competitors. I blinded those competitors here, but also to compare ourselves to others in the industry in our state, but also to look more at the retail side as well, which is One Medical. And so we really feel that digital engagement of our patient community is a key determinant of their activation and their care processes, in addition to their loyalty to the organization. And so while we're differentiated today, interestingly, our competitors are all on the same EHR platform with access to the same tools and capabilities. And so we've really focused on speed to execution with the digital capabilities that we have available today, as well as looking at our roadmap and anticipating our patient preferences for how they engage with us digitally and virtually, but also how we can really anticipate their needs moving forward and really continue to build a strong bond in terms of that interaction with our patient community. I think it goes without saying that we can't really have a conversation about digital transformation without talking a little bit about artificial intelligence. We could easily spend an entire presentation on the topic, but I think that there's great potential, and I think we'd all agree to really improve healthcare outcomes and experience with AI technology. I really appreciated some of the statistics that were generated from a survey that occurred earlier this year here in the US. And it was really about how the American public perceives the promise for AI in diagnosis, treatment, cost, and really affecting healthcare disparities. But simultaneously, a significant majority of Americans also express concerns about AI in healthcare, particularly as it relates to the lack of human oversight. And you heard a little bit of that in Dan's presentation as well. And so while we think that AI offers an opportunity to enhance healthcare operations, to really help assist in diagnosis and treatment, it does introduce some new risks and some regulatory concerns. And so it's really been a balancing act in our organization as we've really focused on how we can really differentiate our organization in terms of how we're using artificial intelligence in our healthcare delivery processes, but also on the business side of the organization. And be able to move swiftly, but also to move cautiously on opportunities as they're identified. And so one of the ways in which we've approached the balancing act is really focused around a dedicated AI oversight structure with engagement of our chief executive officer, other executives, and clinical leaders in the organization to make sure that we're understanding the risks that we may be accepting and rolling out certain AI capabilities, but also the value that can be generated and how we can mitigate those risks with countermeasures. And so we've been very intentional and proactive in selecting different AI initiatives that really get at one or multiple of the value dimensions that you see outlined here. So I'll talk just about a few of the initiatives that we have underway in the organization. They really do span clinical, administrative, as well as areas of business focus in the organization. I think one thing that we're experiencing, and I think probably obvious, but it's really clear that the rate of change will never really be as slow as it is today as it relates to artificial intelligence. And so these cycles of development and proliferation of capabilities just continue to increase. And so some of the examples of AI that we're using here in the organization today, we've deployed AI with our radiologists, and so they're able to generate a clinical impression based on dictated findings. They're finding great efficiency in that, in time savings, but also reducing cognitive burden. Ambient listening is probably the most prolific example of AI, at least in American healthcare today. So we were early adopters of ambient listening in our organization, in our ambulatory environment. We're now beginning to spread that into the acute care setting, starting with our emergency department physicians. We're using AI to help summarize the chart. And we've also deployed AI in our business services. We have a demonstration project where we're automating the coding that's occurring currently with our technical billing on the hospital side, but looking to move into professional billing as well in the near future. And we're really seeing some remarkable results in terms of accuracy, but also the quality of the coding. And we see that we have an opportunity to think differently about our workforce in this area as well moving forward. And then we've really created a community in our organization. We have a private internal connection to ChatGPT. And this has really become what I would call kind of a hub to crowdsource ideas about how we can use generative AI safely and effectively in our organization. We've really created kind of a sharing economy where we're bringing our employees and our physicians together to talk about how they're using generative or GPT to address different use cases and to tackle different problems and challenges, both on the clinical side as well as on the administrative side. Last couple of slides, I just wanted to kind of pivot. We had a major cyber event here in our organization 4 years ago. It took us offline for 3 weeks. And I think it goes without saying that anytime there's an unplanned downtime, it's it's unnerving. It's unnerving for our clinicians, it's unnerving for our patients, and it's certainly unnerving for the IT team. During that 3-week period, we had a lot of standard work that we were able to deploy so that we could continue to serve our community. But at the same time, we were also forced to really develop creative and innovative solutions to address the lack of access to data and information during that time frame. And so where we have begun to really focus our efforts is, as much as it is important to have a strong information security and IT backbone in terms of disaster recovery and backups, we've also gone to the point of care and really started to engage our clinicians around clinical continuity and how we can build a more reflexive muscle in the event that we do have an extended downtime, whether that's related to a cyber event or some other emergency situation that results in lack of access to systems. And so we have sort of taken a proactive step to work across our organization through different scenarios, really with the purpose of focusing around sort of 3 domains. And those are really communication tools that are available to clinicians and to other end users during an outage. And then we've identified different processes that we really want to test our capability around. And so we're finding this to be a very effective way to really engage and be sure that we're being thoughtful as to how we're planning and preparing in the event that there is an extended downtime in the future. And then I'll just wrap up and talk a little bit about some of the work that we do as well. There's a group that is called the Arch Collaborative. We participate in the Arch Collaborative about every 3 years. And we do this really purposefully. We go out to our clinical community and we really seek input and feedback around their experience in the use of our electronic health record. And why is this important? The feedback's really critical, one, to drive our performance improvement activities. But I think from a healthcare perspective, healthcare is really all about taking care of people, often in their most vulnerable moments. And we know that technology can really help us do that even more effectively if the technology is designed effectively, if it's utilized as it was envisioned to be used. And so this really is motivational for the IT team in terms of gathering the feedback and the input so that we can approach our organization in a very intentional way to help ensure that the technology that we have available or that we're considering will meet its expected benefits. And so we're really pleased about our progress. We just wrapped up the survey this past spring. We received our results. You can see the data here. There's always opportunity for improvement. What I would say is that our focus around end user training and education, shared governance, and then really an emphasis, particularly with our physician community around personalization, have really been key determinants of our continued growth trajectory as it relates to satisfaction and the use of the EHR. And we're able to take some of the critical feedback as well and turn that into performance improvement opportunities and feed that back to our clinicians and our end users across the organization. So just a little perspective on some of the work that's underway here at Scripps, and really appreciate the time and the opportunity to share today. And with that, I'll turn it back to you, Pierre.
Thank you, Shane. Thank you so much. And I'm looking forward to come in November to you with a bunch of German people, and we're really looking forward to keep in touch with you personally and not about video. And yes, have a really good day, and until November, a very good time. See you soon, brother.
Great. Thank you.